everyone. Welcome to our presentation tonight. I am Christy Keith, a Senior Communications Strategist for Fear Free. We'd really like to thank you for being here and also thank our sponsors at SIVA for making this presentation possible. We're so grateful to them. Before I introduce our speaker, there's just a few things I want to go through. One, Dr. Landsberg will reserve time for questions at the end of the presentation. Please feel free to ask them when you think of them, though, because I'll be gathering them throughout the webinar. This makes it easier for us, so please don't hoard. Go ahead and just ask them as soon as they pop into your head. And if it turns out he does address what you're asking about, I will know that, and I just won't ask a question. Second, we get asked this all the time. Yes, this presentation will be available to view on our website. It usually takes us a week or even 2 weeks to get it up, depending on whether it needs some editing or not. But it will be at fearfreepets.com/webinars, and it will be available to everyone. So you'll be able to share it with your colleagues, watch it again yourself, whatever you want to see it for. Also, during our little run up to this event tonight, Dr. Landsberg and I had a tiny bit of trouble with some of his videos. It may have actually just been on my end and won't affect you. But if you have problems viewing the video, please pop that into the chat window as well, so that I can tell him, and perhaps he can describe what you're seeing in such a way that it will compensate for any problems viewing. And then when the recorded version is done, we will edit in the videos. You may not have any problems at all. I just wanted to let you know that all you have to do is type into the chat window to let us know, and we'll see what we can do to make it right. With all that said, you can also type any problems you might be having with audio or anything else into the chat window, and I'll help you as best I can. So I would like to introduce Dr. Gary Landsberg. Dr. Landsberg received his Doctor of Veterinary Medicine degree from Ontario Veterinary College in 1976 and is a diplomate of both the American College of Veterinary Behaviorists and the European College of Animal Welfare and Behavioral Medicine. He also currently serves on the ECA-WBM Executive Board. He offers behavior consultation services at North Toronto Veterinary Behavior Specialty Clinic in Thornhill, Ontario, and serves as a consultant for the Veterinary Information Network, which is VIN. He has, I really thought I could get through this intro without my lingering bronchitis interfering. I apologize for that. He has authored and edited more than 100 research papers, articles, and book chapters, and co-authored Behavior Problems of the Dog and Cat in 2013. Thank you so much for sharing this presentation with us tonight, Dr. Landsberg. Please take it away.
Thank you very much, and we'll get started now. As you can see, this is combining our fear-free approach, a fear-free look at the science for pheromone therapy. Our sponsor, SIVA, has provided some of the slides that I'll be showing, courtesy of them, as well as Ursia, who I'll talk to you about as we go along. So let's get into the presentation. I know I didn't tell you what Ursia meant, but you'll see it in the comments. So we're going to talk about the whole category of chemical communication. I'm not necessarily going to read all the words on the slide, but chemical communication is the channel through which an individual can send or receive messages using means such as water, soil, air, for the spread of the chemical substances. And the substances stimulate receptors within that animal and thus give them information that causes behavioral changes, which we'll talk about primarily, but also physiological changes, as you'll see. We're going to talk mostly about the pheromones that have been produced that can affect behavior, but we'll give you some of the data and research as we go along. And there's just one of the papers that describes pheromones and mixtures or chemicals. The whole topic is referred to as semiochemicals. That's chemical messaging. And when you talk about chemical messages, pheromones are intraspecific actions. The species that produces them picks them up and responds to them. There are chemical messages, and that's the book that Danny Mills and Maya Brime and Helen Zolch put together on pheromone therapy and their effects of stress. There are chemicals that work between species. None of these are necessarily important for the talk today, but it is important to realize that the whole category is referred to as semiochemicals, and the ones between members of a species are pheromones, which are only detected and picked up by that species. And you have allomones, which would be an advantage for an emitter. In other words, they give off defense or repellent type chemicals. Pheromones, which are advantage for the receiver, but actually harm to the emitter. So they give them off, but if the predator can pick those up, that's a bit of a problem. But it is sometimes used, and some of these are produced also by the same people that make pheromones for pest control or for repellent of parasites. Pheromones are advantage for the emitter and receiver, such as a substance that maybe a plant or animal produces to attract another species, plants specifically to attract insects for pollinating, and then the last one, which really doesn't, something we're going to talk about, it's emitted by dead material. So pheromones, those intraspecific within the species communication, are secreted by glands within the species. They are low-weight components, as you can see, a mixture of fatty acids, esters, alcohols, amines, and ketones. They're not actually an odor. This is not the sense of smell. We'll talk about it in a moment. But animals have to detect that the pheromones are there so they can take them up and react to them. So basically, you're talking about often stimuli such as urine, which would attract the animal to the urine, and then the pheromones can be detected there, or visuals such as the scratching of a cat on an object or a dog after it eliminates. So they're chemical messages, but in order that the species goes and perceives them, picks them up, they have to be attracted to them by visual or odor usually. They are responsible for subconscious changes so that we have, and hormonal changes, so behavior and hormonal. And we have two types of pheromones as categories. One is the releaser, the one that gives off an immediate behavioral response. These would be more like the alarm pheromones, the defense pheromones, the sexual attraction pheromones, recognizing kin, the mother and the offspring, territorial marking, trail recognition. Or an example that I have there is that sows and estrus become immobile when they're exposed to androstenone. Primers take longer to work. That's more what we're talking about when we alter emotional state and physiological states, hormonal states of those animals. So that in some species, rodent species, the introduction of an unfamiliar male can cause spontaneous abortion. We have ram and boar effects that can cause animals, females to come into heat or begin cycling together or induce estrus. And we have the pheromones that alter emotional state, which are the ones we're going to be talking about primarily. So enough about the background into pheromones. Let's start talking about some of the practical. We develop, or Ursia and companies that make synthetic pheromones, develop structural analogs for therapeutic use for their communicative calming effects. There are the cheek gland pheromones, which are referred to as the F3 fraction, the ones that are in Feliway that are for marking of the environment, calming in the environment. Maternal appeasing pheromones. In the dog, that would be dog appeasing pheromone. In the cat, it would be the Feliway Friends or the Feliway Multicat. Just different names in different countries. In the US, Feliway Multicat. And interdigital pheromones, which are the ones that are in Feliscratch or feline scratching, encouraging scratching in an area. They're natural, they're not toxic, they're not absorbed, they're easy to apply because they're applied to the environment or in a collar on the pet. We'll talk about the specifics, So really, what we need to talk about for the rest of the time, if they're that easy to use, if they cause such natural responses, let's show you the evidence that pheromones, how they work and that they work. So the clinical applications, just as a summary from the ones we just talked about, we mentioned F3, which is referred to in the synthetic analog commercially as Feliway Classic. There are studies, as you can see the list there. We'll talk about some of these: transportation, veterinary visits, hospitalization, marking, inappropriate scratching. We'll talk about the second being felis scratch, which is the feline interdigital semiochemical. So the word semiochemical again there, that's for inappropriate scratching. We'll talk about the cat appeasing pheromone, which is from the mammary area, which is Feliway friends in Europe and Canada, and multi-cat in the United States for cohabitation and managing conflict between cats. And you can see all the uses and applications for Adaptil listed there, the dog appeasing pheromone, and we'll talk about these. So that's just a summary of the clinical uses. Let's talk for a moment about where pheromones work. Hopefully you can see the numbers on your screen there. I don't know if I have a pointer that actually works, but we'll start with number 1 on the right, and you'll see the pheromones aerosolized into the air. Number 2 is the incisive duct, where they're taken in through the roof of the mouth. We'll see, show you a close-up in a moment. Number 3 is the vomeronasal organ, which is where the pheromones are picked up. They are where the pheromones accumulate, also known as the Jacobson's organ. And from there, there are nerves that transmit to the brain. And specifically, the nerves number 3 are number 4 are the olfactory nerves. Number 5 are the vomeronasal nerves. Number 6 is the olfactory bulb, and number 7 is the amygdala and hypothalamus. So we've got a pathway that goes through the incisive papilla into the VNO, vomeronasal organ. The molecules then attach to the nerve endings lining the vomeronasal organ where there are receptors. The nerves are triggered. They conduct impulses to the brain. And we'll talk more about the amygdala and hypothalamus, are the emotional centers of the brain. Don't need to go into this again because it's just the dog model with the same labeling. You can see the pheromones, then the incisive papillae, incisive ducts, then the vomeronasal organ. You can see the number 4 olfactory nerves, number 5 VNO nerves, number 6 the olfactory and accessory olfactory bulbs, and number 7 the emotional brain, the amygdala and thalamus. This might give you a little bit better picture overlying a dog skull or dog anatomy, and this one's labeled for you. So I just thought I would throw this one in so you'd see one more time this pathway from the incisive canal to the vomeronasal organ, the nerves, vomeronasal and trigeminal, and the olfactory and accessory olfactory bulbs. So to get pheromones into the body, to perceive the pheromone, to enhance the perception, there's a response that, as I said, the pet is attracted to, which would be visual or olfactory, and then the active response to take in pheromones, which is referred to as flamen or a gape type response. It's pretty dramatic in the horse on the right there, so that's why I left in the equine picture. You can see it in the incisive papillae at the roof of the mouth where the pheromones enter. And to get in there, there has to be a motion, a movement, an orientation, the gape or flamen response, where the pheromones are perceived. So we'll try our first video here, which is a cat perceiving pheromones, short video, and then the gape response, flamen response. So if it's playing, you can see the cat sniffing, licking, and perceiving, and the gape response or flamen response is the term for it. So that's getting the pheromones up into the incisive papillae and opening up the vomeronasal organs so they can be perceived. Next, we have the dog's response to pheromones. It's a similar video, but you'll see that dogs respond in a somewhat different way using their tongues, sometimes referred to as tonguing, to get the pheromones to the roof of the mouth. Sometimes we don't necessarily, owners don't see, we don't see the flamen response. It just means it was quicker or enhanced without as dramatic a response. So here's a dog sniffing the environment, and there goes the tongue, which is not just licking, it's taking that pheromone to the roof of the mouth, to the incisive papillae. And the dog is probably responding, this is both of these videos are from SIVA, dog probably responding to urine from another member of its species to enhance the pheromone response. Looking at what happens next is that once the pheromones enter the vomeronasal organ, they go into or are perceived by the olfactory bulb, accessory olfactory bulb, and the response is at the level of the amygdala, which is where emotional learning takes place, where fear responses can occur, and where fear conditioning can occur. So that basically, if we have an amygdala response of fear, you're going to have a pet that becomes conditioned to the stimulus, the situation, the veterinary clinic, the coat you're wearing, the instrument that you're using, and have a conditioned fear response at further exposure. You also have activation or response in the hypothalamus, which gives you that rise in blood pressure, the panting, the heart rate. And if we can, through calming procedures, fear-free techniques, fear-free methodology, implementing fear-free, through the use of pheromones, together cause the pet to be calm, have no fear response, a minimum fear response, we are not going to get that activation of the amygdala. We are not going to get the hypothalamus response. We're not going to get fear conditioning. So ideally, while pheromones and fear-free methodologies and fear-free implementation can reduce fear, anxiety, and stress, the goal is to prevent. The goal is to not have that reaction in the first place through preventive measures, through positive environment, through giving owner appropriate counseling, through keeping an emotional record of the pet for future visits, through working through methodology that's going to keep that pet as calm and positive as possible, through pheromones and through the procedures that we do, which are fear-free. These slides are from ERCIA because sticking to the science of fear-free, ERCIA is the group that out of France, the research institution out of France, and now also an educational institution, which was founded and operated by Patrick Bajat and his group. They have the methodology for identifying pheromones, for chemically analyzing the composition, for screening to see what effects the pheromones will have or what's the best chemical to get a response, for finding the form to deliver that pheromone, and then the evidence that it works. So it is a highly scientific and specific process to identify the secretions, to analyze them, to screen to see which secretions will have an effect and what's the best chemical to use, and then to develop the pheromones. ERCIA is, and I didn't want to try and pronounce the French, it's the Institute of Research for Semiochemicals, Ethology Applied. Order, a little out of order, because if I tried to say it with a French pronunciation, I won't get it, but as you can see, it's Institut de Recherche en Semiochimie et Ethologie Appliquée. I shouldn't have even tried. But in any case, this is their research institution. I'm obviously just showing you the lobby, the education, they train residents, and it's where the research to identify and screen and produce chemicals, semiochemicals occurs. Multiple species. They've got fish semiochemicals that are used in aquaculture to repel parasites, and farm animal semiochemicals for calming. So multiple species. There's even human semiochemicals. But we're going to talk about the applications for dogs and cats. So we can see identification. There's pheromones coming out in the top left of a cat that's scratching, and then on the bottom left to try and isolate some of the chemicals coming from secretions. On the middle is the nursing puppies, from which there could be calming secretions, and there are. And then you've got the bunting or the cheek marking of a cat, of which there are multiple semiochemicals, one for the environment, which is F3 fraction, and one that's social, which is the F4 fraction. So now we've identified where there might be chemical communication and where the chemicals may be used and where the pheromones may be identified and found. And then you have to analyze those secretions, which are done by sample collection, gas chromatography, mass spectrometry, and then the chromatogram looking at the secretions themselves and their breakdown so that they can be analogs can be produced. Once the analog is produced, then you want to see if you have the right synthetic analog. So this is some of the internal research, testing versus placebo in a controlled environment to see if the semiochemical works compared to a placebo in scratching. On the left, you'll see, and these are shots that have been sped up to show you about a few minutes, but there's only about 30 seconds of video. This is placebo. The cat is scratching a post that's got placebo. It's still got the marks on it, visual marks. And there's some scratching, and if that was spread up 3 or 4 times, it might have been 15 or 20 seconds, and then no further interest in the post. And this can go on for a little while. It actually comes back, looks at it, but that's the placebo. Looking at whether the semiochemical that was developed or the pheromone that was developed is effective is this one. So this cat comes in, and you can see the increased length, intensity, and duration of scratching, which doesn't stop, may intermittently stop, but continues for several minutes. Rubbing up against it, sniffing up against it, scratching. And I'm going to play this video for the same length as the last one so that you can see the increased duration, intensity of response, and interest in the mode of the semiochemical, which would be ultimately structurally reproduced as Feloscratch. Now it needs to be delivered in a clinically applicable situation. And there are many different ways to do it. You're all familiar with, I assume, the diffuser form of administration for dog appeasing pheromone or Adaptil, and F3, which is the Feliway. There is the ability to put BAP into a collar, and with the warmth and contact against the dog's neck, release the dog appeasing pheromone in that form. Sprays have been developed for use of specific locations such as carriers, tabletops, etc. And then you see the slightly different method of administration, the liquid with a coloring for Feloscratch. So that's the fourth step. And the final step is the clinical evidence. And I just pulled a dog appeasing collar study, double-blinded, placebo-controlled, pheromone collar study in a laboratory environment for sound, the dog appeasing pheromone for new puppy adoption, the dog appeasing pheromone for puppy classes, the Feloscratch or synthetic semiochemical for scratching article, the publication for synthetic dog appeasing pheromone for separation anxiety. And I'm going to go through these, but yes, there are scientific publications, many of them double-blinded, placebo-controlled, open-label trials after something is launched to see their effect, and laboratory studies, especially early on, to show that there's a true clinical effect or a true product effect over placebo. So let's look at evidence. You don't need to read these, but in 2015, SIVA put together two charts, one on Feliway and one on Adaptil, of all the studies, which ones were placebo-controlled, meta-analysis, the topics that they would be, clinical applications for each, general welfare, urine marking, etc. And you can see in 2015, and there's been 6 new double-blinded trials or new publications since then, there were 21 Feliway references and 26 Adaptil references at the time. And in fact, I listed most of them to the left there, all the publications related to F3 or Feliway, all the publications related to dog-pleasing pheromone, the Feliway scratch or feline intradigital semiochemical, and the cat-appeasing pheromone or Feliway multicat. So there's the evidence, and we're going to review it as we talked about in the promotion for our talk today. 3 ways: fear-free veterinary visits, fear-free happy homes, mostly related to pet adoption, and a little tiny bit on where pheromones have also been used for specific fears and anxieties. But we want to concentrate primarily on fear-free veterinary visits and the use of pheromones in preventing and alleviating fear, anxiety, and stress, and in pet adoption in the new home. There's the product line there. So pheromones for fear-free veterinary visits, taking an evidence-based approach. First of all, where do we use them? Carrier training, improving travel, veterinary hospital itself, the procedures itself. And in the hospital and in travel, you would be using primarily Feliway Classic or Adaptil. But also when the pets return back home, there can be a great deal of stress, and maybe Feliway multicat as well as the Feliway may apply, especially if there are multiple cats in the home. Talking about their use, I just put 1 or 2 slides on how they would be used. Adaptil and Feliway Classic would be used in the veterinary clinic as a spray, perhaps for travel in the carrier. There's also pads available, or on surfaces where the pet is going to be lying in the car, blankets, etc. Diffusers would be used in reception area, examination area, treatment, and recovery areas. Sprays would be used in the cage itself, cage coverings, surfaces the pet may sleep or lie on, and clothing, especially if the pet, for instance, on the bottom right, is in its carrier. But you might also examine a pet on your lap or on sitting on a chair on your lap or on the floor on your lap, in which case you probably would want the pheromone Feliway in that case on your clothing for where the pet's going to be lying or sleeping, or on the blanket that you're going to put over your clothing. Towels such as blanketing, floor mats, so anything the pet's going to lie on. Examination areas, surgery, recovery, and wards, you might put it wherever the pet's going to lie or spend time. Usually fleece, blankets, towels, the pet's own bedding, and then we have the options of bandanas. You can get detailed information, from your SIVA representatives. So I only have 1 slide that summarizes the tips. First of all, bandanas, where you might spray bandanas with Adaptil and place them in the waiting room with some signage so that the clients can put them around the pet's neck. Probably spray them at least 5-10 minutes before so that a little bit of the odor can evaporate, the carrier, the vehicle, the alcohol. And most of the time when you spray something, if you're not cleaning in between, you have a few hours, maybe even 4 or 5 hours of effect. Bandanas can also be used with animals in the treatment areas and the kennels. Using a towel, you might spray towels in the waiting room so that people can put them over their carriers. You might spray towels with Feliway in the exam room, or the towels that the pet's going to lie on for handling or for bedding, and towels that you might put into the cage or over the cage. So there's just some examples of where you might use the sprays, where you might use the bandanas. So let's go to the evidence. The rest of the time is about the evidence and how you would use them. So we're going to look at the collar, perhaps in the car or in a carrier. We're looking at Adaptil right now, or maybe a bandana on the dog, 5 minutes before, 10 minutes before, and for several hours it should last. There was a study with DAP colors where for car ride, this was an open label study, so it was not specifically placebo controlled. And they looked at different groups, from groups that were excited to groups that were nauseous. And looking at all the groups, the greatest significant decrease in problems was in the nausea group. The double-blinded placebo-controlled trial that was done at the International Veterinary Behavior Meeting is a presentation, and all those proceedings are published proceedings with the ISBN numbers, was a DAP spray where it was used both for physical signs and for behavioral signs. The greatest effect was actually over 4 car rides in reducing salivation, urination, defecation, and vomiting compared to placebo. But here are the behavioral signs based on owner improvement. And you can see the importance of placebo groups. You can see that even at the first visit, the blue, and on the left is the level of improvement. On the bottom is 4 different trips. There was improvement in the first trip, which was significantly higher in the DAP group, but also the control group owners thought there was improvement. On the second trip, also significantly higher improvement in the DAP group, but still owners thinking their pets in the control group were getting better, but not by the third and fourth trip. By the third and fourth trip, the control groups were not getting any better, and there's a highly significant effect on the fourth trip of the DAP collar over the control collar. What about cats? You can spray the carrier, you can spray the bedding of the carrier, you can spray before the pet goes in, and positive outcomes have been shown. You also should be desensitizing and counter conditioning for the carriers. And we're not talking about the behavioral parts right now, but every one of the things we're talking about, every one of the topics we're talking about, you need a fear-free behavioral approach, which would be having positive outcomes, treats, and enjoyable outcomes, and desensitizing and counter conditioning when there's fear. Nice little pamphlet was put together by ISFM, Association of Feline Practitioners, and SIVA as a sponsor, that you can get off the AFP website, the ISFM website, or from SIVA. In a study, Feliway improved versus placebo, and in that study, they looked, this was an International Society of Applied Ethology, they looked at 100 to 500 kilometer car rides. And in that study, both the physical signs and the behavioral signs were significantly improved in the Feliway group over the placebo group. These are the global scores from that study. Again, it was printed at the International Society of Applied Ethology. You can see the references, and all the references are available if you want them either from SIVA or specifically from me by contacting me at the end after the presentation. Overall global scores calculated from indications of stress showed virtually no fear, anxiety, stress in the Feliway group, and on a global score averaging 10, 11 in the placebo group. Now the veterinary clinic. There was a study on Feliway combined, and this was many, many years ago, which was with acepromazine, which would not be our choice right now. I almost hesitated to show this study, but it is one of the first studies. It was published in Veterinary Anesthesia and Analgesia. But they combined Feliway plus acepromazine. This is something that we've done 12 or 13 years ago for visits to the veterinary clinic. And they were calmer with the feline F3, Feliway, and acepromazine than they were with placebo and acepromazine. And this was related to handling and catheterization, handling prior to catheterization. Of course, we have gabapentin, we have trazodone, we certainly have benzodiazepines, which all would be more appropriate anxiolytics if you're using drugs. Either alone or together with the Feliway. In another study in 2000, published in JAVMA, Griffith and their group looked at placebo versus spray in 2 different parts of a study. The first one was the first 2 hours being in the veterinary clinic, and the Feliway group had more grooming and more interest in food. They also did 24-hour housing in the veterinary clinic, and the greatest food intake was in the group that had not only Feliway, but their own carrier inside the kennel, inside the hospital cage. That was compared to placebo alone or Feliway alone. So Feliway plus the carrier. There is the grooming in the first 2 hours. You can see the Feliway level, the number of episodes in 2 minutes, 125 seconds. Oh, sorry, 2 hours, 125 minutes. And the interest in food in the Feliway group in blue compared to the placebo group in red. More recent study by Pereira looked at veterinary examination scores. They had a stress score and a handling score, and it was a placebo with a crossover. So one group got Feliway spray and the other one got the placebo, and then at a future visit it was the other way around. And stress scores were significantly decreased in the Feliway group, as were handling scores. And there's the publication in Journal of Feline Medicine and Surgery in 2016. Adaptil in the veterinary clinic. Well, Danny Mills did a study with diffusers, which they put into the exam room and into the reception area. And they found that when they measured the outcomes, they did behavioral measures of the outcome. This was blinded placebo-controlled study. They were more relaxed in the waiting room and the first couple of minutes of the consultation compared to placebo. Study using DAP or Adaptil in veterinary clinic wards found hospital areas found less fear, anxiety, and distress in the diffuser group. That was published in the Canadian Veterinary Journal in 2010. And in a study by Carlos Siracusa, where they used a spray post-operatively, the Adaptil spray had dogs that were more alert and more exploratory post-operatively, and they had a less of a decline in prolactin with the spray than they did with placebo, indicating reduced stress. There was that study in Journal of the Veterinary Medical Association. More evidence was a diffuser study in a shelter environment. So that would again support use in an environment, decreased arousal, decreased barking, increased resting and sniffing of people. A DAP collar in a shelter environment versus placebo. So again, indicating what might happen in an environment, a hospital situation or a shelter situation. Decreased stress-related behaviors, decreased vocalization, and increased relaxation. And this was an open label trial, so there wasn't a placebo group, but they looked at both puppies and adults post-adoption with DAP, and there were DAP diffusers in the home, and both of them had less hiding, panting, trembling, and separation behaviors. The other place we should look at from the veterinary visit is the return back into the home. Looking at the adoption studies and the shelter studies that I just mentioned, there certainly seems to be less stress when you have Adaptil or Feliway, which we'll talk about in a few moments, in that environment when the pet comes in. So that would make sense to have it back in the home to help adapting with the environment. But in specific studies, there was a cat study where cats had Feliway, and it increased appetite, marking, and social behaviors. What has been found, and this isn't related to Feliway, this is 2 different studies, a study by Chiara Mariti that found that 58.5% of cats were stressed when they went back home after the veterinary visit, hence the hiding, maybe inter-cat, interspecific conflicts that you might get. And in a Bayer AAFP state of the veterinary profession study a number of years ago, they found that some cats are fearful for days when they come back home. So we need to do something about that environment to increase their appetite, to decrease marking, to improve social behavior. So in this one study that Dr. Pajat did back in 1997, they sprayed a vacation home or a holiday home before the cats came in with either placebo or Feliway. So this was sprayed into a home before there were diffusers available, the day before the pet was brought into the environment. They found that in the holiday home that had Feliway, there was less marking, the cats were faster to eat, and if they went outdoors, they were more likely to return quickly back to the environment. This actually shows you the time taken for cats to eat in that new environment, if there was Feliway in the environment and if there was placebo in the environment. So they ate faster, they marked less, and they were more likely to return and stay in that new home when they were first introduced. We also have studies to show that Feliway multicat versus placebo decreases aggression scores and stress-related scores when you put cats that are in conflict together. So again, there might be a place for feline multicat in the home when these cats are returning. And that's the study just recently. It's actually still in only online and will be in print very shortly, but it's the evaluation of efficacy of appeasing pheromone by Teresa DePorter and others that was published in the Journal of Feline Medicine and Surgery. So get something into the home because 58.5% of them are going to be stressed, some fearful for days, and maybe intercat conflicts and fear if we don't get a proper program of positive reintroduction, gradual reintroduction, and ideally pheromones, maybe even medications for pain and stress. Stress and immune health, there's been studies looking at this. There were smaller studies, but of course, stress can have an effect on mental health, welfare, and physical health. And if you affect the immune system of a pet, that should say wound healing. That was my first spelling mistake that I see. There can be decreased wound healing. There can be gastrointestinal signs, decreased eating, increased respiratory disease, urinary tract disease, all contributed to by stress. So there were two studies, one looking at idiopathic cystitis, which was a 12-cat study, but by the time the study was completed, there were only 9 cats. But it was a crossover study, and while it wasn't highly significant, there was a trend toward fewer signs of idiopathic cystitis. This were cats that were pre-selected for idiopathic cystitis when they had the Feliway in the environment than when they had placebo in the environment. So 2 months on the Feliway or placebo, and then they were crossed over. They also had more positive, friendly behaviors and less negative behaviors. And then a recent study looking at feline herpes virus, Feliway versus placebo, there was a decreased stress response leading to decrease in herpes, which could lead to a decrease in herpes virus. So we've got both the physical and immune health and the behavioral health and welfare of pets. Just a little bit on making your home fear-free, the reintroduction to the home, the introduction of new pets into the home, prior to veterinary clinics, after veterinary clinics. And Adaptil has been shown to reduce puppy adoption stress, to improve socialization, to reduce noise aversion, to help with separation distress, and Feliway Classic for urine marking and scratching to attract cats to the appropriate area for scratching, Feliway Multicat for cat social interactions, and Feliscratch for inappropriate scratching. So where are the studies and the evidence for that? Well, first of all, if you're going to prevent and alleviate fear, anxiety, and stress, you need to give the behavioral guidance. And this is just a study that actually showed that in a dog situation, new puppy adoptions, a behaviorist gave advice for the first visit for about 30 minutes. So these would be puppies just adopted versus another group of puppies that did not have behaviorist advice. They then looked at them a year later, and there was less soiling, mounting, mouthing, begging, aggression, excess play, and demanding food at the table. In cats, same thing, giving advice one time, first kitten visit by a behaviorist versus a group that did not have the advice from a behaviorist. Less climbing furniture, curtains, vocalization, attention seeking when owners were resting, and improved handling. What we're saying is that veterinarians must give preventive advice when they first see the kitten and puppy, and they'll prevent all kinds of behavior problems. Puppy and kitten classes, especially done in the veterinary clinic at the socialization age, will lead to less fear, less possessive behaviors, more social behaviors, less punishment was used in dogs that were in puppy classes versus dogs that had not been in puppy classes. And if the clinic classes are positive, one recent study showed increased retention. So if you hold those classes in the clinic and give positive advice, more pet owners were found to retain their pets, keep their pets, and come back for veterinary care than previously 8 or 9 years ago when there were not so positive training and no clinic classes. So that was studied by Teresa Porter that she's presented a number of times. And then pheromones have been shown to improve adoption into new homes, socialization, and Feliway for social contact, clicks, eating, marking, and scratching behaviors. Here's the evidence again. Pheromones decrease stress with puppy adoption. There was a diffuser study versus placebo. And when they put the diffusers in the home versus placebo in the home, there was decreased vocalization. In fact, it was about 3 days to 5 days. It was significant at the first day, decrease in the diffuser group versus the placebo group. But over 2 weeks, there were still vocalizing dogs in the placebo group. And within 5 days, there were no vocalizing dogs overnight. This is nighttime vocalization in the diffuser group. The two studies at the bottom are collar versus placebo. They were studies of close to, I believe it was maybe 50, I'm just trying to recall. I think it was over 60 puppies that were given either Adaptil or DAP collars or placebo collars when they were first adopted. On the left, you can see there's a significant decrease in vocalization, and again, at 5 days, it's pretty much gone in the DAP group, and in the placebo group, it's still there after a couple of weeks. Sorry, the first study was 3 days with the diffuser group. It was significantly decreased, and 9 days it took to decrease in the placebo group. So whether it's diffuser or collar, you'll get less nighttime vocalization, more settling, and then interesting responses when you check the dogs at 3 days and at 15 days, where that compared to the placebo group, the Adaptil or DAP group had decreased vocalization, decreased fear of strangers, and decreased fear on walks. And you can see the significance there in the column, the third column that's red, fear reactions when walking outside at day 3 and also at day 15. And on the far right, signs of fear with unfamiliar people at day 3 and also at 15. This was a study that the first one was diffusers versus placebo diffusers in puppy classes, and there was decreased arousal and increased appeasing behaviors in the diffuser classes. So these were 2 diffusers plugged in a puppy school. But the second study was done with collars, and it was done by myself and Dr. Siggy Dannenberg as part of his residency project. He's a board-certified behaviorist in Toronto, formerly with Bristol. And he actually looked at 2 things. First of all, the decrease during the classes in the collar group versus the placebo group. There were 4 classes, 1 small dog classes, 1 with collar and 1 with placebo, and 2 large dog classes. So bigger dogs were seen in different puppy classes. At week 2, 3, and 4, and the final week, and this would be